Good day. My name is Nichole Taganas, student nurse from Isabela State University at Taganas, BSN 1-2. Today, we will be doing moving, turning, and positioning. What is patient positioning? Patient positioning involves properly maintaining a patient's neutral body alignment by preventing hyperextension and extreme lateral rotation to prevent complications of immobility and injury. Positioning patients is an essential aspect of nursing practice and a responsibility of the registered nurse. Goals of patient positioning: provide patient comfort and safety, maintaining patient dignity and privacy, allows maximum visibility and access. Remember, change patient's position every 2 hours, helps to prevent muscle discomfort and undue pressure, maintains muscle tone and stimulate postural reflexes, assess the skin and provide skin care before and after a positioning change. Next is to gather all necessary equipment. We will be needing pillows, blanket, trochanter, and head rolls. So in our case, because we are not in a hospital setting, we don't have appropriate materials and equipment to use. So I just improvise trochanter with the blanket and hand rolls with socks. Because we need to be resourceful as we can be. Note, for most techniques, ensure bed height is at waist level to reduce leaning over the bed. But as I've said earlier, we should be resourceful enough and improvise. Before handling the patient, we should perform hand hygiene and put PPE if indicated. First thing we'll do is assess our patient. So let's assess our patient's ability to move and flexibility. Then look for the presence of tubes, incision, and equipment before positioning our patient. As you can see, my patient is currently lying down. Good morning, sir.
Good morning, nurse.
Okay, can you raise your hand?
Yes, nurse.
Okay, down. Can you stand on your own?
Yes, nurse.
May I see? Okay, you may lay down again. As you can see, my patient can move independently and he has nothing on him. No tubes or equipment.
Yes, come in.
Good morning, sir. I'm Nichole Taganas and I'm here to assist you for today. Sir, how are you?
I'm okay.
May I know what's your date of birth?
October 23, 2008.
What's your name, sir?
Translator Henderson, Taganas.
Okay. Now, I'm going to position you into supine. Is that okay with you, sir?
Yes, nurse.
Okay. First, slide patient into the bed. Place pillow under patient head. Place small roll towel under patient's lumbar area of the back. Okay, 1, 2, 3. One, two, three. Place pillow under patient's forearm in both sides. hand roll on patient's hands. Place trochanter roll parallel to lateral surface of the patient's thigh. And lastly, place footboard or pillow against the bottom of the feet with toes pointing upwards. And this is the supine position. Please make sure whenever you are moving a patient that you count to 3 to alert the patient and give them time to prepare for the move. For example, sir, I'm gonna move you. I will count to 3. 1, 2, 3. Then, you proceed.
Yes, come in.
Good morning, sir. My name is Nichole Taganas, and I will be your aide for today. I will be moving you to the side of the bed. Is that okay with you, sir?
Yes.
First, wash hands and check patient's wristband. Since I've already washed my hands, I will check my patient's wristband. May I check your wristband, sir?
Yes.
Okay. Provide patient's privacy with curtain or screen or door. Since the door is already shut and the curtain is already down, I can proceed to the procedure. Adjust bed to safe working level. Usually waist high, but since we don't have an hospital bed, we will be using our ordinary bed. If the patient head is not lowered, you would lower it. You're going to stand on the same side of the bed to which the patient is being moved. Stand with feet and shoulders width apart. Bend at the knees, and if your back is straight during the procedure. First step, slide hands under the patient's head and shoulders and moves them towards self. Slides hands under patient's midsection, shoulder, and hips, and move it towards self. 1, 2, 3. Slides hand under patient's hips and legs and move it towards self. 1, 2, 3. You will be moving patient in 3 sections: head and shoulders, shoulders to hips, and hips to legs. Remove privacy measures. Open the windows. Leave the call light within the patient's reach, if it's available. Are you comfortable, sir? Is there anything else I could get you?
I'm comfortable, thank you, and I'm all set.
Okay, sir. Good morning, sir. My name is Nichole Taganas, and for today, I will be assisting you in turning in bed for you to have a proper body alignment. First, may I know your name, sir?
Hans Victor Helmutson, Taganas.
Okay, may I see your wristband? After that, we will proceed and give our patient privacy by closing door, window, or curtain. Assume that I've already done that. First, we need to lower the side rails of the bed. So assuming that we already lowered the side rails, if not already in place, we will be placing a friction-reducing sheet under the patient. Next, we need to use that friction-reducing sheet to move the patient on the edge of the bed towards which he opposite to the side towards which he will be turned. Okay? 1, 2, 3. putting the patient's both arms across his chest and cross his forelegs over the leg nearest to us. If available on the bed, we will be activating the bed mechanism of the bed to inflate the side of the bed behind the patient's back. The nurse on the side of the bed towards which the patient is turning should stand opposite to the patient center with his or her feet spread out at about the shoulder width and with his one foot ahead of the other. After that, we need to tighten our gluteal and abdominal muscle and flex our knees, and we need to use our leg muscles to do the pulling. After that, the nurse on the other side of the bed should position his or her hand on the patient's shoulder and the patient's hip on assisting in rolling the patient to the side. Next, we will be instructing the patient to pull the side rails of the bed at the same time. And then, we will be using the friction reducing sheet to gently pull the patient over his side. So let me go on to the other side. Let us assume that the other nurse is on the other side of the bed. I will be using the friction reducing sheet now. We will be turning the patient on our side. The nurse on the other side will help me push the patient towards my side. Okay, sir? One, two, three. Next, we will be putting the pillow on the patient's back for support. We will be pulling the shoulder blades of our patient forward and out of the under patient's back. Now, we will be putting pillow on our patient's legs and arms. We will be readjusting the patient's pillow on his head. We will also elevate the head of the bed as needed for comfort. So let us assume that I have already elevated the head of the bed. We will proceed to lowering the bed in the lowest position with the rails up and making sure that the call bell is within patient's reach. For example, let's assume that I have a call bell. Sir, this is your call bell. So you will know what to do when you need something. And this is how you do turning on bed back to side. Good morning, sir. I am Nichole Taganas and I will be your aide for today. First thing we'll do is to move you over to your side. Can you bend your left knee, sir? Okay. I'm going to put a pillow behind his back to support his back. Then I'm going to place another pillow in front of him to support him and his upper arm. Next, I'm going to place his underarm into his pillow and place a hand roll on his hand. Lastly, I'm going to place another pillow between his legs. So, this is how you position the patient into side-lying position. Good morning, sir. I am Nichole Taganas, and I am here to move you into Sims position because the doctor told me to do so. Is that okay with you, sir?
Yes, nurse.
First, turn patient onto his side with his arm and shoulder drawn behind his body. Okay, 1, 2, 3. Then sharply flex his leg upward. Then make sure that his arm is slightly flexed. Then support his leg by putting a pillow. And make sure that his legs is slightly flexed. Lastly, put a trochanter roll onto the patient's feet to protect his feet. Sir, are you comfortable now?
Yes, nurse. Thank you.
So this is how you position a patient in Sims position. That would be all, and I hope you enjoy my return demonstration of therapeutic positioning. Again, my name is Nichole Taganas, your student nurse. Thank you for watching!